Hey everyone, Dr. Saccone here with MedCore Asthma and Pulmonary, giving you the latest COVID-19 update. I've done my best to keep these updates as apolitical and unbiased as I can because I feel you deserve apolitical and unbiased facts. That being said, I'd like to say that we're very aware of the social and racial disparities that are going on currently, and we are going to continue to do our part to help move things forward in this regard. However, this is a forum for education on COVID-19, and this will be the only focus for this discussion. So, on this topic, here's an interesting piece of information. About 2 weeks ago, I tested positive for COVID-19. I was tested routinely as I go into different nursing homes, and this was required. It was my first time being tested, and I guess I just like to go big. Since I had no symptoms, I then opted for the antibody test to confirm my diagnosis, and this also helped me to pinpoint the time of my infection. My antibody test was positive, and this indicates that I was infected a few weeks ago, and I didn't have any symptoms then either, and it was not likely that I was infectious at the time I was diagnosed. Now, these concepts, the swabs, the antibody tests, reinfections, lingering infections, these are going to be the majority of my discussion today. I'm planning to give you a crash course on virology and immunology, and then break things down and discuss what we know and what we expect to be true with regards to the immune response. But first things first. What's happening with the cases and deaths in the region, especially given the reopening, the protests, riots, and everything in between? The United States continues to show an overall decreasing number of cases with a continued trend in the right direction. It gives some sense of leveling off, which is likely the expected plateauing as things begin to open up and the new cases emerge. There's obviously concern of a spike in cases as many of the protests, both peaceful and not, were not practicing perfect social distancing and mask wearing, etc. This data will be watched very closely because it will give insight into the role of asymptomatic spreaders, open air transmission, and then temperature, UV light, etc. We'll need to pay close attention to the specific areas where there are higher levels of protesting, as they will show more subtle spikes if they do occur. Now, New Jersey continues to move forward. The number of cases and deaths both are continuing to decline. I pointed out Memorial Day on the graph, which is when the beaches reopened and the restrictions were relaxed. There is a continued decline with no significant spike seen. The daily new cases have been well below 1,000 and often less than 500. Daily deaths have been less than 100 for the past week as well. And really, this is fantastic news. Not only are the cases and deaths showing great trends, but again, we have not seen any detriment from the reopening thus far in New Jersey. This is echoed in PA as well, which also continues to show a significant decline in daily cases. Pennsylvania hasn't seen a daily new case total over 1,000 since May 10th, and the numbers have been steadily declining since, and do not seem to be affected by the reopenings. Kentucky, on the other hand, seems to have a bit of a surge around the first week of June. This is likely a function of the reopenings, and it's not clear if it will be a sustained uptick or just a quick bump. The deaths have not seen a rise, so this leads me to believe that the cases are primarily in the healthier population, which is going back to work, resuming normal activities, etc. There may be a lag in deaths, and that will be seen in the next week or so. However, there also has not been an increase in hospitalizations, which also supports that this is a function of just increases in testing and cases among the healthier patients. Again, Kentucky's curves are concerning when you see it by the cases, but they do not seem to reflect an uptick in hospitalizations or deaths. So there is cause for concern, but this isn't necessarily a surprise. As we see increased testing and we start reopening, we do expect more cases. In fact, it could be seen as good news in the fact that it's not translating into devastating cases and that the at-risk patients are being protected. There have been some reports that the risk of asymptomatic patients spreading the virus is very low. The World Health Organization stated it is, quote, very rare for an asymptomatic person to transmit the virus. Then, they later clarified that they don't really know the exact figures. So, what do we know? Well, what we know is that we spread the virus most when we are the most symptomatic. This makes sense because we need a way to expel the virus from our bodies by coughing, sneezing, etc. So people who are truly asymptomatic have a hard time passing it to others. But what really classifies as being asymptomatic? I told you, I tested positive and I didn't have any symptoms. I mean, I did have a cough, but I have allergies and I have had an ongoing cough for months. So, although I may have been asymptomatic from COVID, I still had the potential to infect others. So, I am happy that I've been very diligent wearing my mask, social distancing, and also been very aggressive with washing my hands. Now, how did I get it? I have no idea. But I've taken care of over 200 COVID patients in the hospital, rehabs, etc. So likely I picked it up there. The good news is that my wife tested negative and she did not have any antibodies. And everyone I've been in contact with, including my office staff, was negative too. So thankfully, it doesn't appear that I infected anybody. I quarantined and have since had 2 negative tests, which is why I'm able to come back to work. So let's talk about the swabs and the test and why some people test positive for a while. To understand this, here's your crash course in microbiology and virology. This describes how viruses infect us and replicate. If you follow this picture starting at the top, a virus attaches to a cell in our bodies. It then injects its genetic material into the cell, and in the case of coronavirus, RNA. Genetic materials like DNA and RNA are what tell the cell what to do, how to look, what size, what shape, and what substances like different proteins, etc. that it needs to make. When the cell gets viral genetic material into it, this hijacks the cell and tells the cell to make the material for the virus and then assemble it. Once the new viruses are assembled, they get released, or shed, and they go on to infect other cells and then further multiply. The viruses can get trapped in our mucus and secretions, or other bodily fluids and other viruses, and can get expelled when we cough, sneeze, etc. And then you inhale this, or you insert it when you touch your nose, your mouth, your eyes, etc. And then you get infected. Now, the body's response to the infection is to produce antibodies. Antibodies attach to the virus and signal the body to kill the virus or prevent it from completing its life cycle. While the body is fighting off the virus, we have the highest level of symptoms. This is when the viral load is the highest and the body is working its hardest to clear it from you. After a while, the virus is eradicated from the body and our symptoms improve. Now, there is a period of time when there is virus being shed before our body recognizes this and fights it off, which is why we are infectious for a period of time before showing symptoms. And after the body eliminates much of the virus, the symptoms will dampen down, but there's still going to be some virus that is yet to be eliminated, so we're going to be infectious for a period of time after our symptoms resolve as well. Now, when we get tested, the swab collects our cells and secretions, and then it looks for pieces of the viral RNA. Obviously, if you have never seen the virus, there's no reason that the viral RNA should be in your body. How come some people test positive after clearing the infection, even weeks or months afterwards? Well, initially, there was concern that the people who tested positive might have gotten infected again. This goes against typical body response to viruses, but since COVID was so new, barely anything could have been possible. But what is likely happening? Well, after the virus is cleared, the viral RNA is still in the cells. The cells aren't producing the virus because of the antibodies, but the genetic material has been left behind, as have maybe dead viral particles too. But these cells with the viral RNA in it have a lifespan of up to 3 months. So if a very young cell was infected but not killed by the virus, you technically could detect the viral RNA for up to 3 months after the initial infection. And this is long after you've cleared the virus and are no longer infectious. The other test that we hear about is the antibody test. Antibodies are proteins that attach to the virus and signal the body to kill it. They're called immunoglobulins, and they get named accordingly. So the antibody immunoglobulin M is also called IgM, etc. The 2 main antibodies that we concern ourselves with are IgM and IgG. IgM develops rapidly in just a few days and peaks and then goes away after a few weeks after the initial infection, while IgG develops later, about 2 or 3 weeks, and stays around for a longer time, and generally speaking, gives us immunity to getting reinfected. Now, this is what we want our bodies to produce when we get a vaccine, and this would give us the long-lasting immunity. We've heard that we don't know if you can get reinfected and if the antibodies mean that much, but honestly, this is mainly due to the fact that the virus hasn't been around very long and we can't verify that fact. However, virtually every other virus that we come in contact with and we clear, we do have long-standing immunity to. Now, as a point of contrast, the common cold, influenza, etc., we can get those multiple times, mainly though because viruses like the common cold are actually multiple different viruses, and in the case of the flu, there's different strains and mutations which are not identified by the body as being the same one it saw previously. But since COVID hasn't mutated much, once we have antibodies, they should provide lasting immunity for about 6 to 12 months, plus or minus. When my swab tested positive, I also had IgG. So this indicates that I was infected at least 2 weeks prior, and that the positive swab was likely the result of residual dead virus or viral genetic material in my cells. So I hope this was helpful. I know this topic can be confusing as we throw around a lot of different acronyms that aren't always clear, but this is the latest data, and it is promising that a vaccine will be useful and that we are getting closer to herd immunity, because as more people get infected and they recover, they will have antibodies and thus immunity. Now, unfortunately, this is likely going to be my last update for a while. The country is opening back up, and a lot of questions have been answered, and many people's fears have been allayed. However, when new information, concerns, or topics arise, I'll come back and update you then. However, until then, I hope you found these updates useful. Take care, stay safe, and God bless. If you like these videos and you want to see more, we do have other ones on our Facebook page and YouTube, and you can like us there. See you later.